Hi there and welcome to the Dawn Show. Dawn Stensland, Mendte here. We are live and we are local, and today we are talking breast health and prevention. We all know that women should get a mammogram every year starting at age 40, but there are other things that you need to do and that you need to know about to prevent breast cancer, or at least lower your risk of developing it. So we have two of the best doctors in our area on breast health in the house right now. Dr. Carruthers, who is the director of a breast health program, Holy Redeemer Health Systems, and of course, back by popular demand, and Dr. Beth DuPree, who's the director of breast health programs at Holy Redeemer Health Systems, and the author of The Healing Consciousness, A Doctor's Journey to Healing, which is a great book. Everybody should have it in their household.
Thank you for having me back.
Yeah.
And letting me bring my partner, Dr. Carruthers.
Yeah. So got some girlfriends here.
I know, we're
in
very
the house.
excited about this because it's a very important topic.
Well, you know, I think a lot of people think, oh, well, I should get the mammogram, but it's hereditary. So it doesn't run in my family, so I shouldn't have to worry about it. You say?
At least 75% of breast cancers are found in women who have no family history whatsoever. So we think that having the family history really, it's important. If your mom had breast cancer or your grandmother or if someone on your dad's side had breast cancer, it's even more important to make sure you get screened. But we all have breasts. We're all women. We're all at risk of breast cancer.
So is that something, are those numbers growing, and is it because of, I don't know, hormones and the foods and all of, the chemicals in the foods, or is that, it seems like it's a number that keeps growing?
The incidence of breast cancer is definitely increasing, and there's a particular population that we can follow, women who carry the breast and ovarian cancer gene, the BRCA1 and 2 gene. We know that we're seeing cancers like almost 10 years earlier in the next generation. So we're diagnosing some women before even their mothers are diagnosed that carry that gene. And what we believe is happening is that the effect of our lifestyle, the processed foods, the lack of exercise, the things that we choose to eat, the alcohol, tobacco, different carcinogens, different things that affect our DNA are bringing that age lower because our bodies are being affected by that. So if you take that and you look globally and you say, well, why are we seeing more and more breast cancer now? Number one, we're screening better. We have better screening techniques, and we're encouraging women to do those screenings. But secondly, we're not living a lifestyle that's conducive to health and wellness. We're living a lifestyle of, let's get from point A to point B, and we'll do whatever we have to do to get there. I mean, looking at fast food and how we choose to eat and how we choose to live, we're kind of fast-paced, flying forward, not really being present and saying, okay, what are the things that we can do as women, all women, not just women who have family histories? What can we do to help decrease our risk?
Well, and we'll talk in a later segment about the whole foods and the healthy foods and all of that. But for women right now, when you talk about lifestyle, is it also stress? In the last show you talked about a personality, that type A personality, which is the personality that gets the job done, the soccer mom who's the Anjali woman who's also
so you're
the corporate
talking about
CEO.
The three of us, right? Okay, so let's just put it out there. We are all type A's, otherwise we wouldn't be doing what we're doing right now. But it's about kind of curbing your type A and saying, you know what, it's okay to be intense, it's okay to live your life with gusto, but you've got to take some time to turn it off and to take some time to kind of get centered and really be present in the moment. And I was telling you before the segment started that this past weekend I spent the weekend with 8 women who are living with breast cancer. They've got stage 4 breast cancer. And the gift that I got from that weekend was to come back home and say, how can I take better care of me? And because we take great care of our patients, but as physicians and as educators like you, we spend a lot of time making sure that we're going out and taking care of everybody else. But each of us as a woman has to say, okay, what can I better do to take better care of me?
Because that's what women do. I mean, we're taking care of our husbands and our kids, and for you, your patients and your practice, it's everybody else. So share a little bit though about this weekend, because you said that we should all learn something from women who, you said they begin to live as they know that they're facing death.
It was amazing because I was looking at the things that we've provided for them. The foundation actually provided, the HCF provided this weekend. And what happens is when you can take people out of their so-called cancer element, a lot of these women are focused on the treatment of their cancer and their next doctor appointment. And we brought them to a place where they could enjoy the beach. And the Sisters of the Holy Redeemer, we borrowed their beach house for the weekend. And we took these women down there and basically embraced them with love and gave them a safe environment in which to talk about their fears and their concerns, and we tied those fears and concerns on balloons and let them fly off into the sunset. And it reminded me that as physicians, we do everything that we can to treat the physical manifestations of cancer, but a lot of times it's the relationship and it's the energy that we share with our patients. It's the women that are so attached to Dr. Carruthers that they're now doing fundraising on their own because they're so thankful for what she gave them that they want to pay it back. And so to learn that from these women, that how much of what we do outside of the operating room and the things that we've provided them that aren't the medical things made such a difference in their lives and in their journey. And it reminds me that I need to do that myself because it's really tough to remember. It's tough to say, okay, DuPree, put on the brakes and be in the moment, because you're great at teaching everybody else, but you
gotta take care of you.
Take a little lesson from yourself.
We're going to take a quick break and we'll talk more about how to take care of you when we come right back.